will also contribute her story and her, she can ask her concerns, which can probably inspire others. Indra, are you there? Can you show yourself and unmute? Indra? Indra Papana? Are you there, Indra? And what these women are trying to tell you all again and again is a woman should take care of herself starting from the adolescent period. This the parents should take care. The menstrual health is important. The nutrition is important. The lifestyle is important. Then after, when you're planning a pregnancy, please reach out to your doctor, because your doctor is a friend, and he or she is not going to always talk about diseases and medicines and those kinds of things, but she can always stabilize you for the better and make you probably less stressed when conception is planned. And even during pregnancy, it's very, very important that you take care of it very well so that you do not have complications. And then post delivery, you have to reach out to your doctor so that the doctor can tell you how to monitor yourself to keep yourself a healthy person. All right. So, yes, Indra is there. Is Indra there?
Yeah, hello.
Indra, are you there?
Hello. Yeah, ma'am.
Video on, Madi. Very good.
Yeah, how are you, ma'am?
I'm fine. How are you, Indra? You're calling from Raichur.
No, ma'am. I'm just in Hassan. I'm going back
Okay.
to my place.
Very nice. So Indra is also one of my old and really valuable patient acquaintance, and she's joined all the way from Hassan.
I'm like how to say, she is like a family. Revathi ma'am is like a family to me.
Please
so first
put your video on, Divya. Put your video on and introduce about yourself, because this is going to several people. They would love to see you.
1 second. I'm not able to see where the
No
video
problem.
to.
You can talk. Yeah, you can talk. We have limited time. You can talk.
Sure. So I have started my journey with Revathi ma'am. I'm still in the process. So as per whatever the comfortness and the guidance she has given, trusting that, I have suggested my brother's wife's second pregnancy also to her. So she, like Revathi ma'am has told me, like she promised me that she will not repeat the first pregnancy in the second pregnancy. And whatever she promised, she has done, and she is all good now. Like from second day of the delivery only, she is all good. And even now, ma'am is monitoring how is she doing, how the baby is doing. Her Kavita's situation was very critical in the first pregnancy, and she conceived within 3-4 months of the delivery. And this was really a challenge. And I think undoubtedly I just trusted ma'am, and I told ma'am about the situation, and she took the situation positively. She gave trust to me and my brother. She filled with confidence ki you have to take care step by step, and she guided every part of the places. So like, it's not only pregnancy she has focused everything. And her delivery was really complicated, because even I was there in the hospital that time. And we are really thankful and grateful to Revathi ma'am ki such a nice baby in our hand now, and mother is also healthy. It is not ki the first time what we faced, not even 0.1% we faced this time. And thank you so much for this, ma'am. And my journey is still on, and I'm expecting the same help, support, and I've give you more than 100% to you.
And I thought you would say, I'm expecting a baby.
That's what I told. I'm in process.
Yes. Okay. You see, ultimately, it's a lot of scientific efforts. And once we know what the problems are, if we put the efforts in the right direction, definitely we will reach our goal. It may not be a straightforward path. It may have several bumpy roads, but then we will travel across evidence with whatever is evidence based, and try to do our best. Yes, Divya's sister-in-law, conceived within 3 months of a cesarean, which was a preterm cesarean and an emergency preterm cesarean. And in fact, they were so worried that they never knew that they were pregnant, but They were pregnant and they wanted to continue the pregnancy, but they did not really have the confidence to do so. So, of course, it's a very difficult situation because generally we don't recommend that a lady conceives within 3 months of a previous cesarean. But then I had to sit with them and counsel and tell them. So, it's so important. So, it doesn't mean that everyone reaches to you in the preconceptional period, but whatever time you you please reach your doctor. And I had to literally sit down and explain across the table that yes, there are certain complications. If you are really keen on continuing this pregnancy, what are the issues, how do we do it? But in spite of everything, they were very ready for surveillance and close follow-ups. And her previous pregnancy was very, very difficult because she had a lot of spotting and bleeding episodes. She was confined to the bed and then finally ended up in a leak and a preterm cesarean. So all these things had literally traumatized her mentally, but then they agreed for a very tough surveillance. We found out that there were certain risk factors which complicated her pregnancy, like clotting abnormalities, sugars, and infections. And we were able to go quite far. And what I'm trying to say is it's so important that all these factors are taken care of by the doctor as well as followed by the patient, as well as the family support is also very important. Divya supported her brother, her entire family supported them. And now the delivery was a very traumatic situation. I mean, it was a very difficult delivery, I must say, but in spite of all that, now things have fallen in place. And, it's all because of, timely interventions and uh, reaching out at the right time. So, access in crisis is what I'm trying to emphasize. So, all this is possible. So I motivate everyone, not necessarily, you should not say, I did not meet my doctor during the preconceptional period, so I will not meet her now. No. At any point of time, please meet a doctor as early as possible. Indra is back. Thank you so much, Divya, for your precious time
Yeah,
on the Sankranti day. And we have Indra
yeah.
back again. And Indra, can you please, ನೀವು ನಿಮ್ಮ ಬಗ್ಗೆ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಕೊಂಡು ಒಂದೆರಡು ಲೈನ್ ಹೇಳ್ತೀರಾ? ಏನಕ್ಕೆ
ಹೌದು
ಮಾನಿಟರಿಂಗ್ ಇಂಪಾರ್ಟೆಂಟು, ಮೆಟರ್ನಲ್ ಹೆಲ್ತ್ ಯಾಕೆ ಇಂಪಾರ್ಟೆಂಟು ಅಂತ ಹೇಳ್ತೀರಾ?
ಓಕೆ ಮೇಡಮ್. ಆಕ್ಚುಲಿ ನನಗೆ ತುಂಬಾನೇ ಕಾಂಪ್ಲಿಕೇಶನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಇತ್ತು. 2 ಟೈಮ್ಸ್ ಅಬಾರ್ಟ್ ಆಗಿತ್ತು. ಫುಲ್ ಸ್ಪಾಟಿಂಗ್ 1 2 2.5 ಆದ ತಕ್ಷಣ ಹಾರ್ಟ್ ಬೀಟ್ಸ್ ಹೋಗ್ತಾ ಇತ್ತು. ಸೊ ಐ ಲಾಸ್ಟ್ ಮೈ ಹೋಪ್. ಐ ವೋಂಟ್ ಗೆಟ್ ಬೇಬಿ, ಐ ವೋಂಟ್ ಡೆಲಿವರ್ ಲೈಕ್ ದಟ್. ಬಟ್ ವೆನ್ ಐ ಕೇಮ್ ಅಂಡ್ ಮೆಟ್ ಡಾಕ್ಟರ್ ರೇವತಿ, she has made me brave, and she has given so much treatment, and all she started, and she has supported me lot. And
ಜೋರಾಗಿ
first
ಮಾತಾಡಿ ಇಂದ್ರಾ, ಸ್ವಲ್ಪ ಜೋರಾಗಿ ಮಾತಾಡಿ.
ಒಂದ್ ಮಗು ಡೆಲಿವರಿ ಆಯ್ತು ಮೇಡಮ್. ಆದ್ರೂ ಮತ್ತೆ ನನ್ಗೆ ಇನ್ನೂ ಒಂದ್ ಮಗು ಬೇಕು ಅಂತ ಅದು ಒಂದು ಆಯ್ತು. ಮತ್ತೆ ಬಿಫೋರ್ ಆಫ್ ದಟ್ ನಾನು ಅದೇ ಇದ್ರಲ್ಲಿ ಪ್ರೆಗ್ನೆನ್ಸಿ ಮಾಡ್ದಾಗ್ಲೂ ಐ ಲಾಸ್ಟ್ ಬೇಬಿ ಬಿಕಾಸ್ ಆಫ್ ನಾನು ಬೇರೆ ಕಡೆ ಡೆಲಿವರಿಗೆ ಹೋಗಿ ಒಂದ್ ಮಗು ಲಾಸ್ಟ್ ಆಯ್ತು. ಅವಾಗ ಫುಲ್ ಹೋಪ್ಸ್ ಕಳ್ಕೊಂಡ್ಬಿಟ್ಟಿದೆ, ನನಗೆ ಮಗುನೇ
ಅಂದ್ರೆ
ಆಗಲ್ಲ
ನಿಮ್ಗೆ
ಅಂತ.
ದಿನ ತುಂಬಿ ಮಗು ಹೋಯ್ತು ಅಲ್ವಾ?
ದಿನ ತುಂಬಿ ಮಗು ಹೋಯ್ತು. ಪಾಪ ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಕೊಟ್ಟಿದ್ರಿ, ಎಲ್ಲ ಆಗಿತ್ತು. ಸೊ 2 ಅಬಾರ್ಷನ್, ಆಫ್ಟರ್ ದಟ್ 1 ಮಗು ಎಕ್ಸ್ಪೈರ್ಡ್ ಆಗಿ, ಆಫ್ಟರ್ ದಟ್ ಮತ್ತೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆದಾಗ ನನಗೆ ತುಂಬಾನೇ ಹೆಲ್ಪ್ ಮಾಡಿದ್ರು. ಲೈಕ್ ಎಲ್ಲ ಏನೇನ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಕೊಡೋದು, ಎವ್ರಿಥಿಂಗ್ ಶಿ ಹ್ಯಾಸ್ ಮಾನಿಟರ್ ಡಾಕ್ಟ್ರು. ಸೊ ಅವ್ರನ್ನ ಥ್ರೂ ಫುಲ್ ಅರೌಂಡ್ 6 weeks to up to 9 months they are giving me all daily injections and all monitoring what all the tests I have to take, and what are so much they are take care. And I had 1 child. After that also, two cesarean already for me, no. It was so complication. I lost hope, like I will get 1 more baby. After that again, like I met the doctor and they told, no, already when I have been conceived, no, ಅವಾಗ ಡಾಕ್ಟರ್ನ ಹೋಗಿ ಮೀಟ್ ಮಾಡಿದೆ, ನಾನು ಕ್ಯಾರಿ ಮಾಡ್ಬೋದಾ, ಸೊ ವಾಟ್ ಹ್ಯಾವ್ ಟು ಡೂ, ಆಲ್ರೆಡಿ 2 ಸಿಸರಿಯನ್ ಆಗಿದೆ, ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ. ಆಗ ಮೇಡಮ್ ಹೇಳಿದ್ರು, ನೋ, ಇಟ್ ಇಸ್ ನಾಟ್ ಎ ಇಶ್ಯೂ. ವೆನ್ ಯು ಆರ್ ಲೈಕ್ ವಿತ್ ಡಾಕ್ಟರ್ ಇದ್ರ ಕೇರ್ ಅಲ್ಲಿ ಇದ್ರೆ, ಯು ಕ್ಯಾನ್ ಟೇಕ್ ಇಟ್ ಆಸ್ ಎ ಚಾಲೆಂಜ್ ಅಂಡ್ ಯು ಕ್ಯಾನ್ ಮೇಕ್ ಇಟ್ ಅಂಡ್ ಲೈಕ್ ದಟ್. ಆಫ್ಟರ್ ಡಾಕ್ಟರ್ ಸಪೋರ್ಟ್ ಮತ್ತೆ ನಂದು ಪೇರೆಂಟ್ಸ್ ಮತ್ತೆ ಫ್ಯಾಮಿಲಿ ಸಪೋರ್ಟ್, ಎವ್ರಿ ಸಪೋರ್ಟ್ ಇಂದ ಮತ್ತೆ ಐ ಹ್ಯಾಡ್ 1 more baby, and now already I am very happy because of 2 children. This is all because all these medications and all, and what all support of doctors. I had come through all that issues, and I had mentally also I become so much like I'll get baby or not, and like, but I came out of that, and I'm very happy now.
Albardo Indra, you should be happy. I'm sure these are all tears of happiness. I know what she actually feels with every abortion and with every the death that she actually faced, because she lost a baby. She was with us for for almost like 32 weeks, and then she had to go to her hometown. And unfortunately, when the baby was delivered, it was a fetal demise. The baby had passed away. So that's the reason, she made sure that she relocated from her place, from Hassan, and she
Yeah.
stayed back in Bangalore till she
Like
delivered her two
Bangalore,
babies.
I had 2 children. I was in Bangalore. Now also I settled in Bangalore for only children's sake. I've settled in Bangalore because I lost hope I won't get baby anywhere else. Like that, I had hope in that hospital, and already I got 2 children,
So
and I'm
what she's
totally
trying
happy.
to say is, yes, having an abortion or losing a baby is one of the most difficult things. I
But
can feel
to
that.
second pregnancy, that sugar and thyroid, everything you have monitored, no? That I was like one step I'm getting tension. What I got sugar and thyroid, what I have to do like that I pressurized. But everything is closed and around very like the second baby like what I expected so easily it has happened because of Revathi doctor. Because so much issues no before and all, but I not faced when I had second children because she's the first day of pregnancy till delivery she was with me. So confident.
So
And
basically, in fact, her older daughter supported her second pregnancy, was helping her mom. So there were a lot of
she's very
emotions that
important
were
woman.
involved. And yeah, hi, how are you?
How are
What's
you?
your name?
My name is Davana.
Okay. So do you know that I monitored your pregnancy?
Yeah,
Okay. Where
very
is your
great.
brother?
My brother is in Bangalore right now. I had a vacation, so I came to the home.
Very nice. So fantastic. I'm so glad, Indra, at looking at your children, and God bless them. And what Indra is trying to tell everybody is, it's a very traumatic thing to have an abortion or an intrauterine death. Reach out to your doctor. If she would have not met maybe a specialist and sorted out her problems, she would not have these beautiful children, and she would be crying all the time. Now she is crying because she is happy, she's overwhelmed with joy. So I want every single lady to do this. Please do not confine yourselves in your homes thinking that you're cursed. Nobody is going to help you. Science is advanced. There's a lot that we can do to help you to have a healthy baby, and take care of yourself. Indra, you should also get vaccinated for cervical cancer. All right. And then take care of your other problems. Just look at your sugars as well as your thyroid problems, because that pregnancy just told you that there is a possibility, but make sure you undergo your regular testing, because it's so important. Like what Kezia said, if a mother is happy, if a mother is healthy, the whole family is healthy. So you have to take care of yourself. So I really congratulate each one of these brave women who actually took time out of their uh, what should I say, of their on this festival and Sankranti, and make sure that they contributed something to make a difference to all these women. So they spread the possible positivity on a festival day. And before I conclude, I have some quotes which were actually shared by Rajgopal, who has been instrumental to have organized this. So I really thank the Mirror Health team, including Shrikant and Rajgopal, who have meticulously got this all in place. So let me just read out some very inspiring quotes. In order to improve maternal health, we have to focus on improving all women's health and access to care, not just during labor and delivery, but before and after pregnancy and throughout our lives. So, this is something that we should remember. And this is beautifully summarized by him, saying that we have to make sure that we take care pre and post pregnancy to make sure our mothers are healthy and the entire family is also healthy as well. So we have other nowadays we can do teleconsultations where you don't really have to always reach out to your doctor in person. It, of course, it has its own limitations, but definitely you can reach out to your doctor and plan your follow-ups and reviews. So with all this advanced technology and treatment for every ailment like metabolic problems can be controlled, autoimmunity can be controlled, genetic problems can be resolved. So with all this, and with so many technologies coming in, ART is on the rise, all those people who are not able to conceive, we have a ray of hope in the form of IVF and IUIs. And this also can be planned well. Preconceptional evaluation will add value when you're planning an IVF, because you will not have an unfortunate event after you have conceived. It's so important that your medical and surgical factors are under control, and this can be taken care of by a maternal fetal medicine specialist. So again, I think we did a great job by talking about maternal health for about an hour. And I'm so glad we had people from all across Karnataka, from Bangalore, from Raichur, from Chitradurga, from Hassan, who have actually joined in today. And I'm sure we are going to mount this on our website and share it across to several other people who would feel inspired from real stories. Thank you once again. And on behalf of Dr. Govindrajan, Team Mirror Health, and everyone who wants to work for making a mother's life better, I sign off and once again wish you a great year ahead. Thank you.